everybody, I'm Dr. Richard Vivedi from zenonco.io and Love Heals Cancer. Today's session is about creating awareness around cancer. Let me first introduce you to zenonco.io and Love Heals Cancer. We guide cancer patients in their journey with cancer. We aim to improve the quality of life of cancer patients through an integrative oncology approach that includes both medical as well as complementary treatments. We provide end-to-end care to cancer patients and help in their counseling sessions, medical cannabis, pain and palliative care, Ayurveda. For today's session, we are joined by Dr. Sunil Kumar. Thank you, sir, for taking time out and joining us today.
Yeah, very happy to join with Zen Onco on this awareness talk. Very good evening to everyone.
Right. So let me take this opportunity to introduce Dr. Sunil Kumar. He is a consultant surgical oncologist with an excellent academic record. He did his undergraduate MBBS at the Madras Medical College, Chennai. Then he joined Thanjavur Medical College for his post-graduation in general surgery. So, sir, is there anything you would want to say before we begin with the Q&A session for today?
So yes, see, after non-communicable diseases, cancer has become one of the leading cause for death, apart from the heart disease or the stroke. So now cancer has become the leading cause of death. So the awareness is among the public is very less about cancer. They all know about diabetes, hypertension, and they take care of it very well. So today's talk is going to be very important in creating awareness among people about various cancers and why they should be approaching early and what they need to be doing. So all this has to be told to them in detail.
All right, sir. So let's begin with the basics, sir. Can you help us understand what is cancer?
So yeah, when somebody talks the word cancer, they always wonder what it is and why this is happening to me. So I would like to explain it in a simple term. Like when we get a injury, you get a wound, and the body identifies that injury and sends signals to that area to tell them that ask them to multiply the cells and heal the wound. And when the healing is completed, the body says stop right now, it is over. So body has an inherent capacity to multiply cells. So when we abuse our body, like smoking or alcohol or unhealthy lifestyle by taking junk foods or avoiding exercise and hormonal imbalance, all this causes some trauma to our body. So these wounds, when having repeated trauma, the signals that say to multiply the cells and stop multiplying the cells gets deranged. So the cells get continuously start multiplying, and these abnormal cells turn out to be the cancer. So why this happens? Everybody says I don't have smoking habit. I have a healthy lifestyle. Still, it happened to me. So these questions also needs to be answered at this point. And this is not a single factor that accounts into these things. There are small lot of multiple factors apart from what I have mentioned. There are environmental factors and lot more to add to this. And they contribute to less than 1% or 2% of this cancer incidence. So it is a multifactorial. So even without you knowing to have a causative agent, you can develop cancer.
Right, right. So, sir, what are the most common cancers which are found in males and females these days?
So when the latest publication has come and it shows in India, males most commonly affected with oral cancers. That is mainly because of oral tobacco use in the form of pan masala, gutka, and all that. So second leading cause is again in males is lung cancer, which is again related to smoking. When we come to females, the main first leading cause of cancer is breast cancer. This is mainly because of the hormonal imbalance that is happening because of the unhealthy lifestyle and the reproductive issues that the females are facing right now. So the second most common cancer in female is again related to the reproductive organ is the cervical cancer, which is the second leading cause in India.
Okay, all right. So, sir, what are some early signs and symptoms that one needs to watch out for?
So there are two things when we come to identifying cancer. One, everybody asks you whether we can prevent the cancer. So is there a way that I could prevent the cancer? Always we say prevention is better than cure. So like all other doctors say, like I don't want to stop with saying follow a healthy lifestyle. I would like to say in specific terms, there are vaccination against viruses which we need to take, like hepatitis B virus, which vaccination has been integrated in our national vaccination program. So that vaccination helps at preventing not only contemplating hepatitis B infection, but dreadful hepatocellular carcinoma as well. And there is another vaccination which has come recently, which is called the vaccine against the human papilloma virus. So this virus is the leading cause of cervical cancer, which is the second leading cause of cancer in women. Apart from that, it helps in preventing against the oral cancers as well. So when these vaccines have to be given to children between 9 and 15 years of age, ideally. But even if they are not taken beyond 15 years, you can consult your nearest doctor to get these vaccines done. So these vaccines prevent specifically these cancers, especially the cervical cancer, the penile cancer, and the oropharyngeal cancers. So this, now coming to how to detect these cancers early, next part. So not all cancers can be prevented, but following a good lifestyle, taking this vaccine can prevent a few of the cancers. Next, we have to identify them early. Why should we identify them early? That remains the question. Because if we identify them early, the more we can use a very simple modality to treat the cancer. And we need not use a lot of morbid surgeries. We can avoid the mortality because of the cancer. So that's why we need to identify these cancers early. So uh, that's why we tell the people that you get screened. So the most common cancers that have to be screened are the breast cancer, where we do a mammogram, the cervical cancer, where we advise a pap smear test, and oral cancer for men, where when they are palm tumors or betel nut tumors, we ask them to have a high risk screening profile, and lung cancers for smokers, and PSA for prostate cancer for male patients.
Okay, I think that is very informative. So, sir, like you specialize in urological cancers, what are some common urologic cancers that you've observed?
So although I specialize in urological cancers, the most common cancers, it doesn't come, the urological cancers doesn't come in the top 5 cancers in India.
Okay.
So, but the topmost is the prostate cancer, which ranks 12th in India among all the cancers. So next comes the bladder cancer, next is the renal kidney cancer, and the last is the penile cancer among the urological cancers. So that's it. Right.
Okay, and sir, what are some common signs? I mean, early signs and symptoms of urologic cancers?
So each cancer has a specific sign. So let me go upon it in detail with a specific site as well. So prostate cancers can present usually in elderly males with increased frequency. That is, you would have micturated around, urinated around 6 times a day. Now the frequency have gone up. Or the night you never got up to urinate, but now you started to get up to urinate at least 2 to 3 times a day. Perineal pain, that is pain in the bottom of your abdomen, and recurrent urinary tract infection, that you might get fever, chills, and pain during passing urine, and sometimes you might not be able to pass urine as well. So these are the most common symptoms of prostate cancer. So coming to bladder cancer, the most common symptom is going to be hematuria, that is blood in urine. So that is a very alarming symptom that you need to take it seriously and immediately check with your physician. Coming to renal cancers, although they say renal cancers presents with pain or a swelling or again blood in urine, most of the renal cancers present with vague symptoms, maybe vague abdominal pain, or detected, you might have gone for some other problem to get a abdominal scan done, you might find a renal mass. That is the most common way we identify renal cancer. So last, coming to cancer of the penis, which is the least common cancer in males. You might find an ulcer in the penis which is not healing for quite some time. So that is the most common way of, or inability to retract your foreskin recently, which we are able to do it before. So these are the most common signs and symptoms which you need to approach a doctor for a urological cancer.
Okay, all right. So, like we've all heard about minimally invasive surgeries. I mean, how safe are these surgeries?
So minimally invasive surgeries can be classified into two. One is a laparoscopic surgery, and we have recently the robotic surgery coming into picture, especially in neurological cancers. So so patients need to understand robotic surgery doesn't mean that robot operates on you. It is the we just place robotic arms inside your abdomen, which is guided by the surgeon. So these two surgeries are more commonly used for urological malignancies, like I described the prostate cancer and the bladder cancer. Unlike female pelvis, male pelvis is extremely narrow because it is not developed for delivering a child. So male pelvis is extremely narrow space. So we need some certain approaches where we can do surgery with high dexterity. So that's where the laparoscopic and robotic surgery come into picture. And it is very advantageous. It helps in early, it is extremely safe. It helps in early recovery. It helps in doing a very good surgery with least morbidity.
Okay, so all right. In a way, the recovery period is reduced after performing a minimally invasive surgery, right?
Yeah.
Oh,
So when we compare, so the gold standard is going to be this open surgery. So when we compare with the gold open surgery, the minimal invasive surgery is less morbid. It gets you back to work early, improves your functional outcomes. That is, if in terms of if you are operating for a bladder cancer, your prostate cancer, they say your urinary function, your sexual function, all this improves drastically when we use all these minimally invasive approaches.
all right, all right. And so, what are some surgical options if a patient has been detected with breast cancer?
Since breast cancer is the most common cancer in women in India, so we need to know what are the options. People should not just desperately think that removing the breast is the only option, that is, mastectomy is the only option. So that's why we ask you to screen early and come early. If it is a really small lesion, we just need to just remove the lesion and surrounding normal tissue. So we need not remove the whole breast. That is called breast conservation surgery. Suppose if the lesion is little bit of a medium sized lesion, then we will remove the tissue along a tumor along with the surrounding tissue. There will be a defect, there will be a gap. So that's where we need to replace the lost tissue by doing a plastic surgery in form of some flap. That is called oncoplastic surgery, which again patient need not go in for mastectomy. That is complete breast removal. Even if it is a large tumor involving the entire breast, even if the patient had to have removed the entire breast, we can replace this tissue from elsewhere with advanced techniques, microsurgical techniques called free flaps, reconstructions. Usually we take the extra tissue from the lower part of the abdomen, what we call the belly. So the extra fat in the lower part of the abdomen is taken along with the blood vessel and kept there so that patient goes back with a new breast. So even if in very large cancers, we will be able to send the patient home with a breast. So mastectomy is not the only option. Now things have advanced. Now, as we have spoken about the breast surgeries, there is another part of the breast surgery, which is the axillary lymph nodes. That is, nodes are present in breast cancer when between the in the axilla. So there is also a certain advancements where we don't do extensive surgery. We do something called a sentinel lymph node biopsy when to identify these nodes to reduce the morbidity of the surgery.
All right. So, sir, like you spoke about undergoing a reconstruction, how long does a patient have to wait before a reconstruction surgery can be performed?
So there are two things to reconstruction. One is immediate reconstruction, what we call as immediate reconstruction, and delayed reconstruction.
Okay.
Most of the time, we will be performing immediate reconstruction. That is at the same setting. When you undergo breast surgery, we will reconstruct at the same time, so that the patient comes in with the tumor, goes out by after removing the tumor and reconstructed new breast. Like for example, if you take oral cancer, the patient comes with oral cancer, oral cavity malignancy. We remove that and reconstruct it at the same time. There are very rare instances where we say ask patients for delayed reconstruction, or patients who are not in a place where they can offer reconstruction. Like you don't have expertise in every place where they can offer reconstruction. They undergo cancer surgery and come back to us for a delayed reconstruction. Usually the timeline for delayed reconstruction is 1 to 2 years. We decide the timeline based case-to-case basis.
Okay. So, sir, but once the reconstruction has been done, can the reconstructed organ or part perform similar functions as to the previous original body part?
So God has given you a part with a lot of functions. So, but we recreate it to make them function as near normal as possible. Like for example, if you take oral cancer, when we remove this jaw bone, patient will not be able to do a few activities like speaking, swallowing, and chewing the food. So we try to recreate it by giving them dental implants and asking them to swallow. So a lot of physiotherapy work also goes behind after reconstruction to make the organ function as closely as what it was before.
All right. Okay. And what are the risks that are associated with a reconstruction surgery?
So the main risk that is associated with reconstruction surgery would be, so you need to bring something else from a different part to that part, right? So you have to mobilize it along with the blood vessel. So when you mobilize it along with the blood vessel, that blood vessel might not be of a good quality, or the recipient vessel might not be of a good quality. Then in that case, that flap might fail. The reconstructed part might fail. So that is the main challenge that is faced, but the chance of this happening is less than 5%.
Okay. So in case if a bladder is removed for a patient, what are the options that a patient has when it comes to passing urine?
So there are two main options when the bladder is being removed. So in the we call something called we sometimes called it's called a bladder neck. That is where we have the sphincters that control the urine. So if the bladder neck area is involved, then the only option left is to provide a conduit. That is, we place a bag in the abdomen and create a conduit so that you can the urine gets collected outside the abdomen and you can frequently empty it. But if the bladder neck is not involved, we can recreate the bladder with the with the intestine inside the abdomen. That is called neobladder. So in that technique, patient frequently catheterizes herself or himself to empty the bladder. So these are the advantages. They can pass via normal way, but they might have to frequently self-catheterize themselves to pass the urine. So these are the two main options when compared for bladder reconstruction.
Right. Okay. So, sir, now coming to the last topic, what are the common screening tests that are available for prostate cancer?
So the problem with prostate cancer, it is naturally an indolent disease. That is, it does not cause trouble to a lot of people. So while screening, what happens is we detect a lot of cancers that will go unnoticed if we don't do that. So the most common test that is performed is a blood test, which is called a prostate-specific antigen blood test, which can detect patients who might have had prostate cancers, and a digital rectal examination, that is putting a finger and identifying if the prostate is enlarged. So these are the two tests commonly performed to identify prostate cancer. But before doing this, we would always counsel the patient that this might be a very low risk candidate for this prostate. So only after counseling the patient, we will be taking them for the prostate screening.
Right. Okay. And what are the treatment options that are available once a patient has been detected with prostate cancer?
So prostate cancer can be detected in an early stage or in a late stage, very late stage where it has spread to the most commonly to the bones. So if it is in a very early stage, if it is a patient is very old, we might put him on just surveillance. We will not do anything. If it is a very early stage and the patient has a very good young patient, good life expectancy, a very early stage, low risk cancer, very low risk cancer, low or very low risk cancer, then these patients will undergo a radical prostate, that is removal of prostate, radical prostatectomy. This will be done mostly with laparoscopic keyhole, minimally invasive surgeries to reduce the morbidity. If the prostate cancer is slightly bigger in size, that is high risk prostate cancer, in that case, patient will go in for radiotherapy along with hormonal manipulation, which is called androgen deprivation therapy. If it has gone beyond the prostate and else it has metastasis, then there are a lot of options in terms of chemotherapy, in terms of hormone therapy, in terms of surgically removing the testis, which is the main source that is going to act on the prostate and makes it metastasize. So there are a lot of options if it has gone elsewhere.
All right. Okay. So I think, sir, we can conclude today's session. It was actually a very informative session where all the basics have been cleared. Is there anything you would want to say to the viewers before we conclude today?
I think there's a lot of information that has to be processed already. So I think more information will put them into a lot of confusion. So it was a very well conducted session, and thank you Zen Onco and thank you Rachana.
Thank you so much, sir, for taking time out and joining us today.
Thank you. Right.